Hey there, this is Leah Kelly, and this is my presentation on the nervous system, and specifically a look into the spinal cord. During this presentation, we will briefly cover the nervous system and the role it plays in our body, and we'll take a closer look at the spinal cord. So, the nervous system is made up of the brain and the spinal cord, as well as nerves and other sensory organs. Together, these components work to communicate signals throughout the body and act as our control center. The nervous system can be divided into two categories. You have the central nervous system, which is the CNS, and it consists of the spinal cord and the brain. And then you have the peripheral nervous system, or PNS, which is essentially everything outside of the CNS, the central nervous system. So here's a nice image to kind of break that down. Here's the CNS, which is the brain, the spinal cord, and everything outside of that here is the peripheral nervous system with your peripheral nerves. So, moving along to the spinal cord. The spinal cord is a very complex structure in the nervous system, and there are many other structures within it that help the spinal cord to do its job, which is sending and receiving signals from the brain. It is located in the vertebral canal, which is surrounded and protected by the vertebral column. The spinal cord stems from the medulla oblongata of the brainstem and protrudes through the foramen magnum of the skull, where it descends down the center of our back. The spinal cord consists of both gray and white matter. The gray matter, which is made up of cell bodies and dendrites, contains synapses. And the white matter is bundles of myelinated axons. And the myelination is what gives the white matter, this nervous tissue, its white color. So, for those of you who don't know, myelination is when an axon has this fatty substance cover. It's like a sheath, which allows for quicker signal transport. So instead of just traveling down the axon here, the signal is able to kind of jump and skip between these myelin sheaths on what's called these nodes of Ranvier. That's French. So it's able to skip along and kind of move faster towards the next synapse there at the end of those telotendria. So let's see. As we said, the main function of the spinal cord is to relay messages throughout the body through the central and peripheral nervous system. And that allows us to think, feel, move, and complete many different actions. So here we'll move on to structures of the spinal cord, and I've highlighted a few that I want to emphasize here. So let's see, first we'll start with the cervical and lumbar enlargements. And these areas on the spinal cord are enlarged, which it's gray matter that's enlarged, which is this gray matter is essentially the machinery for the purpose of innervating limbs. So the cervical enlargement has this wider area, and the spinal cord wider gray matter that is to innervate the upper limbs. And then down here in the lumbar enlargement, it's this wider area of gray matter that innervates the lower limbs. So there's more nervous tissue in these areas because it's essentially the origin point for all these nerves that are going to innervate your limbs there up top in the upper and, as I said, the lower limbs. So then if we move down here, before I get to the cauda equina, I want to point out this kind of purple area. It's not labeled on this diagram, but this is called the conus medullaris, and it's this cone shape, which is where the spinal cord, you can see, is kind of coming to an end and kind of thinning out down there into that cone shape. And so below that you have the cauda equina. And let's see, it's a Latin for a horse's tail. And that's because of the way that all these nerves kind of stem out from one another. This isn't a great picture of it, but if you can just imagine this kind of being the beginning of a horse's tail. And all the hairs that kind of come out from it are all those different nerves and nerve endings that stem down to your legs. So as well as the lower limbs that it's innervating, it also innervates these other pelvic organs in that area. And then below that, distal to the cauda equina, is this velum terminale you see here. And this is sort of a delicate, very thin strand of fibrous tissue. Where that spinal cord is coming to an end, and then distal to that would be continuing nerve roots to your lower limbs and whatnot. And here you can this is just a picture of the spinal column and all the vertebral. You got this 7 cervical, 12 thoracic vertebrae, and the 5 lumbar, and then there's these 5 sacral vertebrae as well. That's what your spinal cord runs through, so in between all that, it's protected by that. Over here you have the central canal. This is a good close-up picture, kind of breakdown of the spinal cord, and you can see the different layers of matter. So you have the pia mater here on the inside, and outside of that you have the arachnoid matter, and on the very outside is the dura mater. Different layers surrounding that, and of course then you have the central canal down there in the middle. And so I wanted to talk about a disease regarding not just the spinal cord but the nervous system as a whole. This is a common disease that affects like I said, the spinal cord and the nervous system, and it's called multiple sclerosis, or MS. And here's some facts about MS. This is a debilitating disease that affects many people worldwide. There's no known cause for this disease, but many doctors and scientists lean towards environmental impacts that may be a factor to those who are diagnosed. This disease is the body's own immune system of targeting and attacking the central nervous system. So it's an immune-mediated disease. Our own immune system is attacking our body. And as you learned in my previous slides, the central nervous system is a vital part of our body and functions to send and receive signals throughout our entire body. So when you have this disease, it is damaging and destroying important neural cells that send and receive those signals. So this can result in disruption of flow of information and a lack of signal transport. And the damage of MS to neural cells gives this disease its name for multiple scars or multiple areas of scarring and scar tissue, which can inhibit the damage to the cell and the interference of the cell signals. There's an estimated 2.3 million people that live with MS worldwide, and there are many symptoms that can include fatigue, impaired vision, tremors, problems with walking, bowel and bladder continence, as well as many different cognitive functions. So here's a great image to kind of show you a regular, normal, healthy axon or neuron, and the axon with these myelinated Schwann cells here. And then you have a nerve cell affected by MS. So you can see there's damage to these Schwann cells, which leads to this exposed fiber here, and essentially can damage the signal transportation. And within MS, this myelination is the primary target. So this is where what they call T cells, which is this little red guy here, T cell, which is sent from our immune system to damage the myelin. It attaches to the myelin sheath here around the axon, and it causes inflammation, which leads to further damage and degradation of that myelin sheath, as you can see along here. So with that damage, you get loss or complete lack of nerve signal. So if I go back here, talking about these symptoms, there are many symptoms that one can experience, and it makes it hard to get a diagnosis for MS. So it's easily misdiagnosed. And there's no cure. There's no cure for MS. However, there are many treatments that can help. That help slow down the disease and help to minimize that inflammation. And early diagnosis is very important, but this is a very common disease many people have, and it can be very damaging to the central nervous system and your overall life. So that is it. There it is, the central nervous system and spinal cord in a nutshell. I hope you enjoyed and have a little bit of a better understanding of the central nervous system and spinal cord now. Thank you.